Hello everyone. Today we will discuss about leptospirosis in the 5 mark short note series. So leptospirosis is a zoonotic infection caused by Leptospira interrogans. It is transmitted to humans through contact with water, soil, or food contaminated by urine of infected animals, especially rats. It is common after heavy rains and floods. Coming to the epidemiology, it is very common in tropical as well as subtropical regions. The reservoirs of leptospirosis include rat, cats, pigs, dogs. Transmission happens through abraded skin, mucous membranes, conjunctiva, contact with contaminated flood water, or soil. High risk group includes farmers, sewage workers, fishermen, veterinarians, and disaster relief workers. In India, Tamil Nadu, Kerala, Andaman Islands, Gujarat, and Maharashtra are considered as endemic for leptospirosis. Coming to the microbiology. So the causative agent is Leptospira interrogans, which is a spirochete bacterium. The morphology of the bacterium will have a thin spiral shaped hooked ends, motile by periplasmic flagella, seen under dark field microscopy. Fletcher's or EMJH medium is used as the culture medium. The serovars include there are over 200 serotypes, including ictrohemorrhagia, canicola, and cryptotyphosa. The pathogenesis. Usually, the entry is through cuts in the skin or mucosa. Then it enters the bloodstream, and then it is disseminated to liver, kidney, CNS, or lungs. Actually, it follows a biphasic course with leptospiremic phase in the first week and the immune phase in the second week. Coming to the organ damages, liver, kidney, lungs, and meninges are the organs that are damaged. In liver, it causes jaundice due to hepatocellular necrosis. In kidney, it causes tubulointerstitial nephritis. In lungs, it causes pulmonary hemorrhage. In meninges, it causes lymphocytic meningitis. So there are two clinical forms. One is anectric leptopyrosis. The other one is ectric leptospirosis. In the former, there will be mild flu-like fever, myalgia, and conjunctival effusion. Whereas in case of icteric leptospirosis, it is Weil's disease, there will be severe form of jaundice, renal failure, hemorrhage, myocarditis, and meningitis. So this coming to the symptoms and signs of leptospirosis. In the acute phase, there will be fever with a headache, conjunctival suffusion, jaundice and photophobia, cough, abdominal pain and vomiting, pancreatitis, cholecystitis, diarrhea, muscle pain. Skin rash is quite rare. In the immune phase, it causes meningitis, bleeding in the lungs. Myocarditis is quite rare but possible. Liver failure, stomach bleeding, kidney failure, melena, and bruises. So coming to the diagnosis part. So blood test usually shows leukocytosis, thrombocytopenia, raised bilirubin, and creatinine. Urine examination shows proteinuria, microscopic hematuria. Serology is the gold standard with MAT and ELISA widely used. Dark field microscopy detects leptospirosis in early phases. PCR detects leptospiral DNA earlier. Coming to the drugs. In case of mild cases, doxycycline 100 mg orally twice daily for 7 days is sufficient. While it is contraindicated in pregnancy and children under the age of 8 years. So the alternative is amoxicillin 500 mg orally 3 times daily for 7 days, and it is safe in pregnancy. In severe cases, IV penicillin G 1.5 million units every 6 hours for 7 days, which is the drug of choice for Weil's disease. And the alternative include ceftriaxone 1 gram per day or cefatoxim 1 gram per day. This is also equally well effective and tolerated. Coming to the supportive and preventive measures. Supportive care includes IV fluids, dialysis in case of renal failure, corticosteroids for pulmonary hemorrhage, and antipyretics. Coming to the chemoprophylaxis, doxycycline 200 mg weekly during monsoon for high risk group are indicated in high risk areas. In case of avoid wading in the flood water, using of gloves and boots, rod and control and sanitation are indicated in flood prone areas. Prognosis depends upon the severity of the disease and promptness of the treatment. Most cases of anectric leptospirosis recover completely within 1 to 2 weeks with appropriate antibiotics. Severe icteric forms such as Weil's disease carry a fatality rate of 10 to 15%, especially when complicated by renal failure, pulmonary hemorrhage, and myocarditis. Early initiation of doxycycline or penicillin therapy and adequate supportive care greatly improve survival. With timely management, most patients make full recovery, though mild renal or hepatic dysfunctionality may persist for a few weeks. Mortality is mainly due to multi-organ failure, particularly in elderly or immunocompromised individuals. So the causative agent is Leptospirosis interrogans. Transmission is through contamination contaminated water or animal urine, common after floods in India. Early antibiotic therapy is crucial. Sanitation, rodent control, protective equipment, and prophylaxis are plays an important role in prevention. I hope you have learned from this video. Thank you.